each time we meet with a survivor, if it's, every 3 months or wherever it happens to fall, is that we assess them for the long-term and late effects, both the physical and psychosocial. And there are many evidence-based tested tools that are available to oncology nurses to provide that, assessment and help our patients. Some of the most common effects, fatigue, I would say, is probably right up there, regardless of what type of cancer or cancer treatment that you have, cognitive changes. And then, some of the other common depends on the type of treatment that you've had. If it's, chemotherapy, if there's cardiotoxic chemotherapy, or if it's neuropathy from some different types of cancer treatment as well. And depending if it's radiation therapy, you're going to see some skin changes or fatigue as well. So just having those assessment tools and continue to monitor them as to find out where they are, and then utilize resources that are evidence-based education. The Oncology Nursing Society has a survivorship learning library, which has a lot of great resources for nurses to educate ourselves so we can help educate our patients. The National Comprehensive Cancer Network has a whole guideline on survivorship as to what to be assessed, and then links to different resources that are available. American Cancer Society, National Cancer Institute, a lot of resources that are available to help educate our patients. And most of them nowadays have an app or an electronic version that individuals can access either at the library if they don't have a computer at home, or on their computer at home. So, based on what we assess with our patients, linking them to rehabilitation services if they need a plan to help manage lymphedema, help manage fatigue, if they have some um, range of motion that they haven't got back, depending on the type of, surgery and radiation therapy that they may have had, as well as the psychosocial, which I think is a little bit more difficult to manage because fear of recurrence is so prevalent. Regardless of the type of cancer that you've had, the type of treatment, at some point you're going to experience that fear. If it's at the end of treatment, if it's before an additional test or follow-up appointment, we, hear it called scanxiety. If we, are waiting for test results, although as a clinician, we think 24 to 48 hours isn't that long, but it's forever for a survivor waiting to hear if, their cancer's returned or not, or if they're clear, so to speak, for another several months. So, just sharing that it's going to take some time for us to get the results back. As soon as we know, we'll call you. And with patient portals that are available, in some cases, they may know before us what the results are. And if they have questions, just to give us some time to find out the results, and discuss it if they're, contacting us as a nurse or advanced practice nurse, to discuss it with their, clinician, is to follow up, what's next. Hopefully it's nothing. We'll see you in a couple more months. But if there's, something that may require additional testing, sometimes there's, some things that aren't cancer that, have a finding that we need to investigate further. So, sharing with the patient and being upfront and transparent with, all right, it's going to take a few days for the results to get back. Depending on the results, we may want to see you, we may add more tests, but don't worry, we're going to walk you through it, whatever those results may be. And I think just sharing that with the patient, the survivor, that, we're still part of their treatment team. We're grateful that they're, getting close to the end of treatment, they've completed treatment, but we're still part of their team and we still work for them. And if they have any lingering side effects, if they have any new symptom, I can share with you that first cold after, finishing treatment, it's brutal. It's like, oh my gosh, is that a cold? Is it the cancer coming back? And now that individuals have more than just a primary care provider, in some cases they may have a surgeon, radiation oncologist, medical oncologist. A lot of questions I get are, who do I call? Which provider? And sometimes I'll say, just call me. Let's walk through these symptoms you're having, and I can help, we'll figure out what is going on and get you to the right provider. And as a nurse, I may know a back way to get you in a little sooner. So that's what I usually share. I want them to feel comfortable and know that I still work for them. And, I want to be available and to help them, whatever their if, side effect they're experiencing, whatever question that they may have. So those are some things that I think are really important that we address, we assess those, utilize the evidence-based resources that are out there, and help our patients know what to do, what's their next step. So that's really important.